Disease-modifying treatment is a term used to describe a drug that changes the course of a disease. Disease-modifying treatments for MS can decrease the number of relapses and slow the progression of disability. Two forms of the treatment are currently available. These are interferons, which are bioengineered forms of a naturally occurring protein, and a synthetic compound called glatiramer acetate. Disease-modifying treatments have been shown to benefit MS patients in clinical trials. Exactly how they work is not fully understood. However, they all act through the immune system to reduce inflammation of the central nervous system. To understand how injected interferons work, we need to look at interferons that occur naturally in our body. These are produced by our immune system, and there are three types: interferon alpha, beta, and gamma. They're called interferons because they interfere with the spread of viral infections. There are some differences in their actions. Interferon alpha and beta have a moderating effect on inflammation, whereas interferon gamma increases inflammation. Although useful in some other diseases, interferon alpha has no impact on MS. Interferon gamma has been studied in MS, but unfortunately made relapses more frequent, whereas interferon beta has been found to be beneficial in treating MS. Interferon beta is introduced into the body in one of two ways, depending on the type of drug: into the muscle, known as intramuscular, or under the skin, known as subcutaneous. The injected interferon binds to a receptor on the cell surface. This binding triggers the release of messages that reach the cell nucleus or decision-making part of the cell. This ability of the interferon to affect the nature of cells allows it to have multiple mechanisms of action, including stopping cells attacking the myelin sheath, preventing the production of more myelin-damaging cells, preventing release of substances that inflame the myelin sheath and allowing the production of substances that prevent inflammation, and reducing levels of harmful interferon gamma. Glatiramer acetate is injected subcutaneously. It is not known exactly how it works, but may mimic a protein found in the myelin sheath and act as a decoy. It is thought to attract myelin-damaging cells generated by the immune system away from the myelin sheath and act on them, changing their activity from harmful to anti-inflammatory.
I'm going to show you, using a diagram in this book, all the different methods of injection. Okay, right.
Interferon and glatiramer acetate treatments are all delivered by injection. However, there are differences between how the injection is given and how frequently. Injection types are either intramuscular or subcutaneous, and frequency varies between once a week and every day.
When I was diagnosed, I was given two options. One was a subcutaneous injection, the other was an intramuscular injection. The intramuscular injection suited me. It was once a week and very straightforward. If I was going away from home, I could just take one injection kit with me, and that would cover me for 7 days instead of maybe 4 of the other injection kits. I never get used to injecting myself, but I think it's more psychological rather than a physical problem. It's in the mind. Once you've done the injection, you wonder what all the fuss was about.
Since being on the treatment, I found I've got a ray of hope. I've got control back in my life. The other things that I feel it's helped with is work. I've got a development move and I cope with that absolutely fine. New job, new move, because I'm a lot less tired, and that has impact on the fact I come home and with my children I have a bit more of a quality life.
Give us a call.
During the past 10 years, the 3 interferons beta and glatiramer acetate have been shown to affect significantly the progress of multiple sclerosis. People who have multiple sclerosis can expect a reduction in the attack rate of about 1/3 when they take disease-modifying treatments, and the attacks that they suffer tend to be less severe. In addition, the 3 interferons have been shown to reduce the rate at which disability occurs. The most dramatic effects of all of these disease-modifying agents are seen on MRI scans, where the effect of inflammation is reduced very considerably by the interferons and rather more slowly with glatiramer acetate. These drugs are not a cure for multiple sclerosis. The disease persists, though it is less severe. But to use them requires commitment on the part of the patient to be willing to take the agents in the long term. Many people who take disease-modifying therapy are able to live relatively normal and active lives despite having multiple sclerosis.
Since I've had MS, the symptoms I've had started with optic neuritis, is where you lose the central vision in your eye. But I compensated for that by turning my head rather than just glancing to ensure the safety of myself and other road users, but I was assured that I was safe to drive, which without driving I would have lost a lot of independence. And at that time as well I thought I might not be able to ever enjoy the simple things like walking along the beach and have a beautiful coastline locally.
After my last relapse, I never thought for 1 minute that I wanted to come off the treatment. The treatment's shown to reduce relapses and reduce the severity of relapses, so I would never want it taken away from me.